Thank you for joining us for Memorial Healthcare's Community Conversations. In this weekly video, experts from Memorial Healthcare will answer your questions about how we're caring for our communities during the COVID-19 pandemic, and also update you on new services and offerings at Memorial Healthcare. Our greatest responsibility is the health and safety of our patients, staff, and community. That's why we are committed to keeping you informed and prepared. Today we will be hearing from Ben Frederick, State Representative from the 85th District and former Mayor of Owosso, Larry Johnson, Health Director, Shiawassee County Health Department, Dr. Dennis Chernin, MD, MPH, Medical Director at the Shiawassee County Health Department, and also Tom Kurtz, the Vice President and Chief Information Officer at Memorial Healthcare.
A lot of our focus from the very beginning has been trying to facilitate needed supplies and coordination and funding for our state's response. And I have to say that Memorial Healthcare has been ahead of the curve really in a lot of these areas when it comes to personal protective equipment procurement and seeking out creative ways to get those supplies through local manufacturing and also testing capacity, which I know will be talked about as well. Really being ahead of the curve is one of the first on-site testing facilities. But at the state level, we're working to continue to build out those resources. We now have a grant program that's been funded for entities, healthcare-related entities and others to be able to secure personal protective equipment. I'm happy to say too that thanks to the outstanding work of our local manufacturers, we've reached a point now where our procurement office is actually stating that we have great confidence in our inventories and our ability to actually meet the need. And that's a tremendous statement about our local manufacturers that really answered the call. And here in mid-Michigan, we saw that facilitated through Memorial Healthcare and others before the state procurement had that capacity. So that's a point of pride for our area as well. But we're going to continue to build out that capacity. Early on, we heard a stated goal of, on the testing side, of 15,000 tests a day. I'm happy to say that we've been able to reach and exceed that. We're now at an estimated 19,000 tests per day. Additional testing capacity, which I know Memorial and other partners have been working on for some time, we're going to see that number go up so that we're able to even more quickly test and trace as we've seen these clusters identified and outbreaks identified so that we can really see a normalization as quickly as feasible. So we're working on that, as well as reforms that were made related to telemedicine, which is something we've certainly seen used. It was something that was in the offing before all of this started, but you're seeing a wider acceptance of what can be done with telemedicine. Some things certainly do require that interpersonal interaction, but there are many things that we're seeing successfully being done with telemedicine, and we did pass legislation to better facilitate that across our state. Overall, I feel that we're focused at this point is concentrating on long-term sustainability of some of these changes. We also saw an agreement in Lansing on education-related reopen strategies, which maintains locally directed reopening plans in those local districts in partnership with public health experts and recognized public health data informing those decisions. So that's an overview of what's going on at the state level.
The health department's been a long-time partner with Memorial Healthcare. And I want to say that just in this last 6 months since this pandemic has really started, that partnership's really been strengthened. And where we are today is we've had over 324 cases, and that's of last Wednesday. We update our numbers every Wednesday, so new numbers are going to come out today. Those numbers are going to increase. We sadly had a resident pass this past week, so our numbers of of deaths is going to be 28 reported today. We've had over 90,000 cases in the state of Michigan, and over 6,300 deaths. So, as a county, what our focus on right now, and this has been taking a very large portion of our time, is the plans to reopen schools. And Dr. Trinan and I have been working every day, all day, with superintendents, with administrators, with the regional education school district, to get them to a place where they all have a workable plan. And they're not all identical, but every plan in Shiawassee County has an option for either in-person or online learning. And these plans were developed following health department guidance. And so that communication with the superintendents has been very important, because as we get into reopening schools, we are looking at the possibility of our infection rates increasing, because now you have people that are inside in buildings, in closer quarters. And so we're doing anything and everything we can to try to mitigate that. We know that there will be infections, and then the health department will have to be involved in contact tracing, testing. That Memorial's set up that site that's so wonderful that we have now. And so it's going to be a bumpy ride as we go into September here, and we don't know what the future holds, but we're going to take one challenge at a time. I want to say I really appreciate the efforts that Memorial did in getting the testing site set up. For the health department, it was really important that we had a component that allowed the uninsured and those without physician's orders to get tests in a convenient and quick manner, with a quick turnaround. And Memorial has made an adaptation to make that possible, and we're very grateful for that.
The testing is essential because we need to identify those people who are positive so that we can isolate them from the general community, because those are the people that are spreading the disease. Number one, we have asymptomatic carriers, which is about 40% of the population, and then we have about another 30-40% of the population who have mild symptoms. And it could be like a cold, seem like a cold, or seem like an allergy. And then, of course, we have the people who get really sick, and that's more obvious. But it's the asymptomatic carriers that we worry about, and the only way to identify them is to continue to test. It's the only way right now, because we don't have a vaccine, we don't have medication really that will prevent this disease. So we really have testing. The universities and in particular we're concerned about, because young adults like to hang around each other, and that's part of the being at that age. So it's a real concern for us right now, how to do that. More testing, the better. So it's important. Masks are extremely important because for both two reasons. One is it protects the other person from getting the disease. So if you cough or sneeze or talk or sing or breathe, then the mask stops that, okay? So it doesn't spew it out to the public, right? It also protects you too. Now, we don't know that part of it as clearly as we do in terms of protecting others, but it does protect you as a barrier. And there's different types of masks. The best masks are the N95s, and these are very good. They're very tight, they're very secure, they're very thick. Then surgical masks are also good. Another one. There's another one called a KN95. They're pretty good. And then the ones with heavier cloth are good. The ones that are real thin, like bandanas, are probably less good, but they do still give you some protection. But the real thin cloth is probably not the best.
In our nearly 100-year history, Memorial Healthcare has gone to great lengths to meet the healthcare needs of our community. We were one of the first hospitals in Michigan to have our own internal testing capacity. That gave us the opportunity to test those in our community with extremely rapid turnaround times, much quicker than most organizations. That also enabled us to create our own alternative care site. At that alternative care site, we were able to route patients that were either suspected COVID cases or those that had symptoms to a facility to make sure we kept all of our patients safe. We also expanded our hospital capacity by a significant percentage. That allowed us to have beds at the ready, both medical beds and ICU beds available for patients in our community that suffered from COVID-19. That additional hospital capacity that we built at the beginning of the COVID-19 pandemic, we've made permanent. And we did that to ensure we continue to meet the healthcare needs of our community. All of this preparation also enabled us to assist many outside organizations with their own testing needs. We were able to go outside to those businesses to test their employees and patients at extended care facilities on site. This allowed us to work with those other facilities to make sure they had rapid turnaround times to ensure their patients and their employees were safe. We've also worked well with our local health department to ensure our local nursing homes and extended care facilities had the testing needs that they needed in order to keep their patients safe. Even now, we continue to evolve in our preparation for COVID-19. We just established our drive-through testing center. Our drive-through testing center is located at 1637 West Main Street in Owosso, right at the corner of Main Street and Chestnut. That location is open Monday through Saturday, 11 a.m. to 7 p.m. Appointments are suggested but not required. We ask that you call 989-729-6422 for assistance in scheduling or to get a provider order. Even if you don't have insurance, please call that number or come to our testing center and we'll make sure you get tested. All of the things that we've done to prepare for COVID-19 from the beginning of the pandemic through now has been to ensure that we're here to treat your healthcare needs for the next 100 years. Thank you for choosing Memorial Healthcare. We're here, we're ready, and we're keeping you safe.
Thank you for joining us today. If you have a question for Memorial Healthcare's team of experts, please visit our website at www.memorialhealthcare.org to submit a question. We will do our best to answer these questions on our weekly videos or in one of our frequently asked questions updates. We ask that you visit our website or follow us on our social media platforms to get up-to-date information. Memorial Healthcare. We're here, we're ready, we're keeping you safe.